And part of what I see now, particularly in social media, are these checklists of you have depression, or the diagnostic categories are these checklists. And what we're not really looking at is what is the context in which this mood symptom and anxiety symptoms are emerging.
Welcome to Healthcare Liberty Labs with Tiffany Ryder, where we teach you what they don't want you to know about healthcare.
All right, Susan, thank you so much for agreeing to come on again and chat with us about yet another just mind-blowing article. So we appreciate you coming back.
Sure, I'm happy to be here.
The title of this one is When Learning Your Way Out of Depression and Anxiety is Not Enough. And it's in my summary, an article about the nuance that goes into sort of defining a path for how to go from anxious or depressed or whatever mental health difficulties someone may be experiencing to a better place, a place they want to be, and the role of medication and treatment and suffering essentially in that process. So I'd love to just start with you just giving us like a quick review of why you are qualified to talk about this topic, because I was quite impressed by reading through some of your background, and then what made this timely for you? What inspired you to write?
So my background is I've been a practicing psychologist. I've worked with people of all ages for I'm going to my 27th year licensed. And then there's, 3 or 4 years before then where you're working as well. When I first started doing this work, it was really very rare that you would refer someone for medication. And you really only referred someone for medication if it was really like an extreme situation, right? Where they really could not function day to day without medicine. Medicine was not the first go-to. Flash forward to now, medication it's just taken for granted. If you're feeling a little depressed, you're having a little trouble focusing, let's get you on a med. And what I see as a result of that is people getting kind of funneled into this medication track and missing the opportunity to learn their way through things. And having done the kind of work that I've done, I have seen a lot of people learn their way out of being depressed by developing better coping skills. The approach that I take is integrative. So I have had people like, let's get your vitamin D straightened out. Let's get you on a regular exercise. Let's get some of the crap out of your diet and let's see how you feel then. Let's try to figure out and rule out certain medical conditions that might be making you more anxious or depressed, right? Let's try to get you to a space where you have as much good, calm energy as you can. And then let's try to tackle this by making some behavioral changes, trying out some different things behaviorally, and also internally. A lot of how we feel has a lot to do with the story we tell ourselves about what we're going through, right? And some of those stories we learn when our brain is very emotional as children, depending on the histories that we've gone through. So this has kind of been my approach for a long time. But what I have seen as my career has progressed, I have seen cocktails of medications thrown at kids because if you go to a psychiatrist, you will get a medication. In my career of working with several thousand people, maybe 3,000 plus people at least, I have only come across 2 physicians who would not prescribe a medication.
Interesting.
And part of what I see now, particularly in social media, are these checklists of you have depression, or the diagnostic categories are these checklists. And what we're not really looking at is what is the context in which this mood symptom and anxiety symptoms are emerging. And I think there's too much of, well, we'll just medicate that. And then there's this, I've seen in younger people, this expectation and belief that they're never supposed to feel psychological discomfort. And I'm like, how do you learn anything if you don't feel discomfort? So where I have started and where I remain in terms of, my ethics and my ideas of good care this is what makes me the rogue psychologist, because I'm kind of back to basics. Let's try to learn and develop skills and to move through. And not to say that medication can't be helpful, but I look at it on a continuum. And the best thing you can do is learn your way out of it. And a lot of people can, with some time and some support. But on the other end, there are some people who honestly, they have such a disruption in their behavioral health functioning. They're going to need some kind of medication to stabilize them.
Yeah.
You know, and so they can't even participate in therapy and the learning process because they're so derailed by mental health issues.
This episode brought to you by Crowd Health. Crowd Health helps you find awesome doctors, negotiate your bills, and fund those bills through our peer-to-peer funding platform for less. Welcome to an easier way to pay for healthcare.
There's so much here from, how to look at the question of even starting a medication in the context of, how acute a problem is and how necessary it is to move to the next step, to, this whole issue of starting a medication means you're on the medication for life, to this issue of how much of this is medical, how much of this is expecting us to function in an environment that is not meant for us to be functioning in. And then I think, even on top of all of that, the idea that questioning it somehow puts you in a category of rogue. And I don't disagree with your characterization. I think that you would be demonized by a large subset of the psychiatric world, because we are really only supposed to recommend medication and lifelong therapy. And, we're not really supposed to question any of these narratives, which is exactly what you're doing. So I'm super excited to start unpacking it. I want to go ahead and start with this idea of when you recommend for medication at all, just from the outset, the idea of, a patient is experiencing whatever it is, debilitating depression, anxiety, ADHD symptoms, and they say, I'm going to go to a therapist. They go to a therapist and they know it's a long-term process. It's going to be a long road. How should we be looking at the idea of a biological cause, or, how bad does it have to be? How long do we have to be sick before we're even considering medication, as opposed to just doing a more therapeutic behavioral route?
So I try to talk with people about the range of things that could be affecting their attention problems. And then what I'm doing is, through getting ratings from teachers, or if someone's an adult, rating from partners, having them complete, empirically based measures to see what's going on with them. And they're broad-based measures. So does this person depressed? Is this person anxious? And it's really a puzzle of trying to figure out what's causing what. I have worked with people who had very high anxiety, and they present as kind of obsessive compulsive disorder. But actually, the problem is they have an underlying attention problem that is not hyperactive, just attention.
Yep.
And they've developed this compulsive overthinking because that's the only way they can track anything.
Yeah.
And if you put that person, if you assess them, and there are actual tests that you can do, that I do with people remotely, to get a measure of their attention over a 20-minute task. How do they perform? Do they perform like people with ADHD or not when they're sitting and completing this distraction type test, which is really informative. So I kind of treat everybody like an N of one. They're an experiment of one. And let's figure out for this person what is fueling their attention problem.
Yeah.
And figure out, really try to break it down and look at, for this one person, what is that about? So I just try to educate people about here are the different possibilities and here are the things that you can try. Stabilizing your blood sugar can do a lot for your anxiety because having good, calm energy by eating whole foods and eating more protein can actually dial back your anxiety quite a bit. Regular exercise, not huge, big deal. 30 minutes a day, go for a walk, can process a lot of cortisol out of your body, right? And when you're anxiety prone, you're producing more of it. And then it just resides in your muscles until you work it out. So, what I try to do with people is educate them about here are all the different things that could be contributing. And then I kind of lay out step by step here's how I would recommend we attack this problem.
Yeah.
And then, if some people, if they have super obsessive thinking, an SSRI will really help them slow down the obsessiveness and then they can tackle the triggers. Now, here's the interesting thing about psychiatric medication that I've come to learn over the past few years. There is no protocol to get you off of it in medicine.
Yes.
Doesn't exist.
Yes.
So I also have to talk to patients about you're going to need to ask your doctor about it. There's no protocol that says they meet with you a year, see how you're doing, and start weaning you off to see if you're better now.
Yeah.
It's not there.
And that's
the
a
doctor,
whole nother issue, right?
the doctor's never going to recommend it.
I did a podcast with my business partner because he recently, within the last year, went off of duloxetine. And to your point, there's no discussion of this. There's no discussion of it on the front end either, where I say, I am recommending that you start treatment with duloxetine because it is, your depression or anxiety or whatever has you so checked out of your life that this is something I believe, really needs to happen. But just so you know, it's going to be a process for us to, wean you off of this because there is no official protocol. And, eventually I believe your therapy is going to help you manage some of these issues that got you to this place. And, we're in it for the long haul. I'm here for you, but let's go. And I don't really think that exists for 99% of patient provider interactions. And I'm curious what your thoughts are because I've seen the shift also. I've been an adult for, 20, 25 years, and I've seen this shift towards more medication, less therapy. I'm recently asked by friends and colleagues to help them find clinicians that are good at their jobs. And, the overwhelming landscape, at least here in Maryland, DC area, is you can't find a therapist who will take insurance. And I know why, right? Because it's a disaster. But I wonder how much of that, look, the insurance isn't going to complain if I prescribe you this duloxetine. But if you are trying to find a therapist, there's a 6-month wait list and it's a disaster. And then if you don't like them and pre-authorization and all of this. So let's just do this and hope for the best. And no one's really actually doing any real math on what the long-term effects of that are for that human.
Well, that's the part, it's been coming to my attention. There's a Dr. Joseph, Josef, is a psychiatrist, and his practice is all about helping people get off medication.
Oh, okay. Good to know.
Really interesting. I think in terms of the being able to find therapists, I think at this point, newer therapists, like what I would say to people in terms of looking for a therapist, if you want someone who's not invested in this medication track, you're looking for an older therapist. You're looking for someone who got their degree late 90s, 2010. But after that, the training is not there. And I think some people might say that some people are very kind of black and white and they go, well, you're not a prescriber. You can't talk about medicine. And I'm like, I can talk about any decision making. We can talk about, it would be a good idea for you to ask, what are the long-term studies on this, right? Like I'm helping someone prep to get the best they can out of their medical appointment. I'm not practicing medicine. I'm saying, here's how you can address your concerns. And here's some questions, and here's maybe make a list and include this and
Yeah.
this. And I think to say to someone, they have no protocol to take you off. So if you want to go off of it, you're going to need to initiate that discussion. And they will do it with you based on what you are asking for, but they will never recommend it. Just so you know, they won't,
Yep.
because then they're stepping outside their protocol. They're not practicing defensive medicine.
Yeah, they're
And
also
then,
increasing their risk because if you have difficulties going off your medication and God forbid something, self-harm or related occurs, then your family is looking at the prescribing clinician. Why did you tell them to take off of this medication that clearly they needed in hindsight?
right. So they're
Yeah.
so they're in a bind. They're
Yeah, they really
absolutely
are.
in a bind. What was interesting, and I learned this by following Dr. Joseph, some people need to cut back very slowly.
Mhm.
And so I will let people know, you know, you can get prescriptions at any amount. The primary care is going to have their check boxes they can do, but you can get a prescription and take it to a compounding pharmacy. And if
Mm.
you're on 20 milligrams, let's say of fluoxetine, Prozac, and you want to back down from that and you want to take 18 for a month, and then you
Mhm.
want to take 15 for a month,
Yeah.
you can get the 18 at the compounding pharmacy. They can do whatever you want. You might have to pay something out of pocket for it, but here's another option.
Well, and that's actually a super good tip because I mean, I'll tell you, and it's again, this is not privileged because, my partner actually came on the podcast on this show and explained how he did it. But he said, he wasn't getting the help that he needed. He was going from, 20 to 0 or whatever the dosage was. And it was completely unacceptable. He was having this, suicidal ideation and depressive thoughts and all of this. And he couldn't figure out, didn't know about a compounding pharmacy or, otherwise
Right.
more, I don't know, controlled way to get off of this
A
medication.
gentler way to step down from
Yes.
it.
So
Yeah.
he was literally opening the capsules. Thankfully, they were capsules. And he would count the little tiny balls that were in there. And he would take 5 out every day for, a week, 2 weeks, whatever it was. Then he would take 6 out for a week, 2 weeks. And this is how he did it. And, that was his option to do. It is his body, and that is a choice he made. And he is now successfully off of it and very happy. But what I love about the suggestion that you just made is if I'm going to a compounding pharmacy to get a lower dosage, then that actually means that someone prescribed me that. So I have a partner in
Hmm.
on my clinical team who is aware of what's happening and sort of like in my corner in my team, and I have a pharmacist, right, who is willing to do this. So what I love about that suggestion is not only does it make it easier for the patient, it means that you're likely in a supportive environment with a clinical team that really wants you to win. They want what's best for you.
Right. They want to work with you on your
Yes.
goals.
And they're there to support you to try to do this thing. And I mean, I'm not saying that everyone can come off of their medication and
No, of
not
course
have a
not.
return of these horrible symptoms that led them there. I'm not saying that. But clearly for my partner, he was in that situation because he is managing extraordinarily well now. And it's
Hmm.
just such a shame to think that someone should have told him, "Oh, I'm sorry, you have to, suffer these, side effects or this numbness. You don't get to grow by being frustrated with your, toddler doing something because you're numb, because we don't have a protocol for getting you off of these meds. So you don't get to learn that life lesson. You don't get to, move forward in your life in those ways." And I just think it's such garbage that we essentially infantilize humans, right? We're treating humans like children and not allowing them to make their own decisions and sort of helping facilitate intelligent ways of them exploring whether a medication really is lifelong, needed lifelong or not.
I actually worked with someone way back when had intense anxiety, but she was also very sensitive to medications. So what she ended up doing was getting fluoxetine in a suspension. And she started with 1 milligram a day.
Meaning a liquid.
A liquid, yes, thank you. And she started with 1 milligram a day, did that for about 2 weeks, then 2. She got herself up to 5, and her obsessive thoughts became so much more manageable.
How interesting.
Now, if you had started her on the entry-level dose of 10,
yes,
it would have she would have said, I'm not doing this. I'm done. I'm not, it would have just completely messed her up. So
Susan,
I think that's the other
such
piece.
A cool story. Yes.
Yeah.
I have to say, when I was reading your article, I experienced a myriad of emotions, one of which was sort of validation and peace and a feeling of being understood, which is, clearly those are all positive things. But I also got really, really pissed off as I'm reading this because it brings up some issues that I've sort of come to in the last, maybe 5 to 10 years of realizing that when the narrative is wrong, right, it's not without consequence. So you were talking about a patient who was perhaps reporting this just sort of, lack of motivation and just sort of blah feeling,
lack
right?
of drive.
Lack of drive.
Whatever, it's okay. It's whatever. And
yes. And as
not
a medical,
having that negative energy that would propel you to do things differently. That discomfort is often very key to making a change.
And there's so much of this in the world. And there's so much of this in the world, and we can talk about it theoretically and, from a policy perspective and as clinicians. But when I look at my own life, and I start evaluating, and I don't talk about this publicly very often, but, I was married for 17 years. I got married when I was 17, then I was married for 17 years, and to a wonderful man who I am, very friendly with, still very much respect and enjoy co-parent with. But I look back at those 17 years. And I took psychiatric medication. I took SSRIs. I was on Zoloft for a period of time. I was on something else. I look at the time that I spent just sort of not really pushing for what's next in my career, not really pushing for what's next in my marriage. I was in a marriage that really wasn't supporting me becoming the best person that I could be, as evidenced by, now I am doing things that are extremely fulfilling and satisfying, in my personal life. But when I look back at that time, I really feel that I gave away my autonomy and my sense of personal responsibility and my choice. I gave that away willingly to my medical team. And my medical team, instead of saying, look, why don't you go to marriage counseling? Why don't you, embrace a career change? Why don't you do these other things? Because, maybe you're not happy because your body and your emotions are trying to tell you something. And instead of really, instead of them guiding the young woman that I was to into that discomfort so that I could learn and grow and develop into the full person that I now know I can be, they said, oh, we're so sorry that you're sad. Here, take the Zoloft, see if that helps. And it did help. But it helped by numbing my motivation, by taking the aspirations and the dreams and hopes and goals and the world that I wanted to create and sort of just making it dead so that I could live in this world that was not my true potential, that was just average.
So you could tolerate it.
So I could tolerate being average. And it makes me angry, not just because of the lost time, but also because the only reason that I stopped taking psychiatric medications was I was living overseas. I was in Germany, and my primary care doctor was like, what is happening? Like, there's nothing wrong with you. Like, you're fine. Why are you taking these medicines? And I was like, well, my doctor said I have to take this for the rest of my life because I'm crazy or something, because I have this problem with depression that just can't be managed. And he was like, he had been seeing me for a while and said, well, it sounds like, your marriage like isn't exactly like everything you always wanted it to be. And it sounds like, you really want to practice medicine, but you're, staying in this other career because it's like safe for you. It sounds like, you probably got some things you could work on that might be the source of why you feel this way. And I came off of the medicine. I was more unhappy for a period of time. I started making changes and I'm living my best life. Right. And it makes me look at these policy changes, at this narrative change through my own personal lens of this, like, could have screwed up my entire life. Right. This could have been my entire life, could have been never pursuing the things that I wanted because there was a narrative that said it's okay to just numb patients for 50 years and then they die. And that's really not okay.
Well, and I think it's a question of looking at each person. Like I have known some people with extreme OCD, obsessive thoughts, and they get on a medication that dials that back, and it is life-changing.
Yes.
So I don't think I've said it explicitly, I'm not anti-medication. I'm for thoughtful use of medication, awareness of how is it helping you.
Yes.
And if you develop compensatory skills, changes in lifestyle and diet, then it's possible the medicine is not necessary.
And that's a great point, and I want to pile on to that. And I'm glad you brought it up because I do think that when I first started the medication in a postpartum period, it was exactly what you described, right? It was needed so that I could do the work that was needed to then function and be successful and feel okay. And I don't regret that. And I think that was the best case scenario for me. I think the issue that I have isn't even that no one tried to take me off the medication, because I also know patients and loved ones who have been on psychiatric medication for decades and likely will stay on them. And maybe that's what's best for them. I think the point that I was trying to make, and I'm so glad that you brought that up because I perhaps wasn't actually making the precise point, is that there should be a regular cadence of reevaluation, of questioning, of saying, this was the choice that we made, and I'm confident it was the right one. Is it still the right choice? Let's decide. And I think that process is one that is just not incorporated into our clinical practice standards. It's not incorporated into our cultural beliefs. And we decide that we are broken and we are broken forever and we need chemical support. And, sometimes our brain does need chemical support forever, but sometimes it doesn't.
I wonder if we need, in psychology, like I'm an integrative functional psychologist, which means I want to get to the root cause of what your issue is. And I'm going to treat you like this. It's also called the scientist practitioner model, which I don't think they teach anymore, but they did when I was being trained. Your patient before you is an N of 1. And you come up with an operational definition. What does their depression look like? And as you do these things, are the symptoms going away? Are they lessening? Are they getting worse? But where you're constantly kind of trying an intervention and then measuring it for success. You're thinking about it, approaching it in a scientific way.
Yeah.
Versus following a protocol. And then when the protocol doesn't work, well, you hear horrible things like this, like, well, they don't take their medicine every day, or they're just not trying, or whatever. I'm sure you hear it in medicine too.
All the time.
And it doesn't occur to people to go, well, maybe not approaching them properly. I've trained a lot of people in my career, and I've had people say, well, I asked them what their goals were and they didn't know. And I said, of course they don't know, because they're not the therapist.
Yeah, how would they
Your
know?
job is to give them a menu of goals that would help them perhaps eliminate or decrease their anxiety or improve their mood,
Yeah.
and see which one they want to try and give them some ideas of things they can try. You don't get to
Yeah.
hang it up because they don't know.
People
I'm like,
with
well, of course they
depression
don't
also
know.
aren't good at seeing all of the wonderful possibilities that are available to them. Come on.
That's a huge piece of it in being a therapist, is holding hope for that person
Yes.
and being able to say, let's at least try this for a few weeks. If it completely sucks, we can get rid of
Yes.
it. But you haven't tried making sure you move every day.
Yeah.
And there's no downside to it. I've never, ever heard a medical professional say, well, you should be sitting in a chair eating junk food nonstop. That's what you really need. That's your problem. And
Yeah.
people laugh when I say these things. They go, no, I don't
Yeah.
think. Picture your doctor saying that. They're not going to say it.
Yes, but just
But let's
having
try
someone there
it.
to say it.
Let's try it
Yes.
and see if it makes a difference. Let's rate your mood before the walk and after the walk.
Yeah.
Let's just try some things to kind of intervene in your own physiology, calm your nervous system, and see if it works. Because the only way you're going to know if something works for you is for you to try it.
Yes.
Because people are different.
Yeah. And I
But
think it is important to note that, just because we say, well, maybe kids shouldn't be expected to, sit in a chair for 8 hours a day. So I'm not giving my kid this medication, right? Like, I can say that, and I actually do believe that.
mhm.
But at the same time, if you are a parent who is lobbying the school board, but they haven't done anything about it, and you're talking to the teacher and you're getting pushback, and you don't have the money to put your kid in private school, and you don't have the ability to move, like, what the heck are you supposed to do? So I think all of this, really
Yeah,
exists along a continuum.
absolutely.
Right. But at the same time, again, things that I'm angry about when I read your article that I think about, like, did I need to take a job in emergency medicine working 12-hour overnights that absolutely 100% requires me to take amphetamines to function optimally? Like, no. I did not need to choose that job, right? And
Right.
so, there is some sort of personal responsibility at the same
Mhm.
time where you say, okay, if I am an entrepreneur and I am doing these things, or I am practicing medicine in a telemedicine capacity that allows me to go for an hour long, workout at 6 a.m. and then another hour long walk at lunch. And then I'm able to get the movement in that my particular body needs to be able
Mhm.
to let my brain function the way it needs to, then that's one option. But if you want to practice for 12 hours with no time to pee in the emergency department, then yeah, you might need some stimulants to be able to manage your ADHD symptoms to do that. But it's like that math is considered, I feel like, by a lot of clinicians as too complicated for the patient.
Right. Part of your job is to educate them about the options. It's like a
Yes,
menu of options, and
it's a
they can
menu.
pick. And they can pick, but I'm a big advocate of, and sometimes this is a lonely space to be in, I'm finding, informed consent.
Yeah.
Let someone know, yes, you can do this, but you also have these other options. There's a lot of this in therapy, like, oh, wait, you can't tell your patient that. Like, I have some huge, unbelievable power over people. And I've never really seen that. No one's going to do
Mm,
something they really don't want to do because I suggest it.
yeah, it's
That's
true.
so rare. So formulate an idea and share it with people, and try to be as research based as you can.
Hmm.
I can honestly say to people, look, the one thing that's going to help your anxiety ultimately is exposure. You got to get in
Mm,
there. You got to live through the thing that makes you anxious. figure out, let your lower brain learn you're not going to die.
Yeah.
And then you can make better choices. So how do we get you there?
Yes.
Because
What a gift.
I don't have a way to help you that's chronic avoidance forever. Like I can't,
Yes.
I don't think that's good for you. That the research doesn't support it. So what we need to work on is how are you going to learn to move towards it and not have it own you?
Yeah. I mean, and that is such a gift. Jordan Peterson talks a lot about this, about like your job is to speak truth because that's what you have to do, right? For your own
Right.
soul, right? So, when I look at it from a clinician perspective, I don't know I can't make this decision for you. There are risks and benefits of pursuing different treatments or no treatment. And honestly, it's not my body, it's not my kid, it's not my whatever. But I
Right.
can say, here's the spectrum, right? Some people look at this problem and they see these risks and these benefits and they decide that's important to them. Other people, look at it this way. Here's how I see it. And I honestly don't see anything wrong with saying the CDC recommendation is this. The research that I have read brings up these questions. Here's how some patients look at it. Here's how other patients look at it. You have to make the decision for you.
Right. I would argue that that's the only ethical, truly ethical
Yes.
way to proceed. And, but particularly in younger generations, I just see more and more people afraid of the psychological discomfort.
Yeah.
And so that becomes part of my job too. It's like, well, let's just get used to being uncomfortable.
Yeah. And you're right. Like this whole idea of it's exposure therapy. You have to get used to the fact that some topics make you uncomfortable. You have fears, you have thoughts, and the only way to get through that is to meet it. And
And to
otherwise,
find they have this concept in dialectical behavior therapy called your wise mind.
mm,
And if you think about the Venn diagram,
mhm,
there's this circle is your rational thought, your emotional thought, and that overlapping piece in the middle where those circles overlap is your wise mind. You're aware of your emotions, but you can also access your rational brain and you
mhm.
can pause and decide how you want to proceed given what's going on. Right. And that's the sweet spot to try to practice and get to and
Yes.
access that quickly as a human being, because then you can make thoughtful decisions in the service of your own goals, not create messes, arguments, drama, strife, stress that you then have to clean up, and so that's kind of where you want to get to be.
So it sounds like if you're experiencing any sort of dysfunction, it's always a good first practice to sort of look at what low-hanging fruit you could address that might help. Diet,
Right.
exercise, things with very, very low risk. Maybe there's medical tests that need to be done. So that's like the
Prioritize
first.
sleep.
Sleep. Yeah, great. So we could look at that as like the first step. So, okay, I did all of those things. I've changed my diet. I had time to change my diet. I had time to explore my sleep because I'm not having suicidal ideation or something that is,
Right. You're
a
not in
medical
a
emergency.
imminent emergent crisis.
Yep.
Right.
So then now I'm like, it's been, 2 months, still not a medical emergency, but I'm just still not myself. What are the next steps? Like, how do you process that piece? And then, for the people who end up doing therapy alone, or for the people who end up doing therapy plus medication, like, how long is long enough to say, okay, we've tried this, like, let's reevaluate, let's look at if something needs to change? I guess I just want to make sure we answer those two
Right.
questions
And
for
and I
anyone who's
wish
looking.
I wish I had a clean answer for everything.
I knew
But
it
I'll tell
wasn't
you,
going to be
like,
clean,
of course not.
but we've got
But
some
it
guidance we
takes
could
at least a
probably.
month to bring your vitamin D level up. So let's say you start with that. You're going to bring your
Mhm.
vitamin D level up. So there's that. That's going to take a month before you notice any difference from that. Then, so it's going to depend on the interventions that you're trying.
Yep.
The other piece that is you have to kind of investigate as a provider is people will say, well, I tried relaxation breathing. And I'm like, well, did you practice in advance? Well, no, I just got really stressed and I tried breathing and it didn't work. Okay, because
Okay.
you don't have a motor skill memory of it.
Yeah.
That's going to work well for you. You'll know when it really works when you have practiced it, when you're calm, you can turn it on like that and you do it. And it's not going to turn you into a cool island breeze. What it's going to do is to bring your brain back on board, relax your body, calm your brain, and then you're going to be more able to effectively manage the situation. So some of it too is working with people to walk through how do you know it's different?
Yeah.
Well, here's some of the things you would see that would be different, right? I don't think this is done with medication. I don't hear about people going, well, they asked me, am I sleeping better? Am I this? Is this? Is this? They're not doing that. They're saying, how are you feeling? You know, you've got like 8 minutes at best actually talking to a patient in primary care,
Yeah.
right? So it depends on the thing, but that's the part where that scientist practitioner model comes in where you go, okay, you will notice this. This will make a difference.
Well, Susan, thank you so much for coming in and being willing to talk with us.
Oh,
And
absolutely. I love talking with you.
it's so fun. And I can't wait until you write the next article. Like, we can make this a regular thing.
I'm working on it. I got a bunch of ideas. So
I love it.
So we'll see.
Well,
We'll
if you
see
aren't
when I get
following
there.
Susan on Substack, definitely sign up for the Rogue Psychologist. It is, I think I mentioned this last time, but literally I found Susan because I just couldn't stop reading her Substack because it was so insightful and thought-provoking and interesting to me. And so we don't know each other from the real world somehow. It's literally her writing that pulled me in. So you should definitely check it out.
Well, thank you. I appreciate it. It's good. It feels good to be heard.
It's so
And I'm
cool,
glad it's
Susan.
helpful to
I look
people.
forward to the next time.
All right, great. Thank you,
Thanks.
Tiffany.
This has been the Healthcare Liberty Lab. Thank you to our listeners and our sponsor, Crowd Health, for making this possible. Be sure to subscribe wherever you listen to your podcast, be it Substack, YouTube, Spotify, Apple, or somewhere else. We're glad to have you with us on this mission to rethink healthcare together.